Hey guys, so this video is for those of you with a hypertonic pelvic floor or a too tight pelvic floor. This is a topic that's really close to my heart. This is how I got into the whole pre-postnatal thing because I had a lot of tightness in my pelvic floor and it caused me lots of problems that really got resolved once I got treated. Now, I want to say that if you have this problem, if you know you have this problem, make sure you go and see a pelvic floor physiotherapist, a women's health physiotherapist. There is so much that they can do to help you with internal treatment of the pelvic floor, with manual treatment of the pelvic floor and the tight muscles there. But sometimes breathing can be the missing piece of the picture, and it can also be part of the problem, part of what's feeding into the problem and making the pelvic floor have to respond with tightness all the time. A really common thing in women with tight pelvic floors is also a really tight diaphragm or upper abdominal muscles, and sometimes this isn't looked at. You need a really good women's health PT to help you figure this stuff out. And I found that this really helped me get to the core of my problems and made sure it didn't come back. It still takes some maintenance sometimes. And it's really helped a lot of my trainees who've got too tight pelvic floors. So I just want to take you through this little tutorial to help you address those issues. Now, if you haven't seen it yet, I want you to go and watch my basic breathing tutorial, because in that I take you through a diaphragmatic breath, and also I help you identify what's going on at the top of the system, so the diaphragm and the upper abdominal muscles. In this video, we'll go back through that quickly, but I've got a 10-minute tutorial just on that, and it's really important to understand that first. So if you haven't seen it yet, go and watch that. And if you have seen it, let's just get started with the next level of that tutorial. So coming and lying on your back, I'm going to start by just recapping our diaphragmatic breathing. So feet shoulder width apart, and just let your knees fall in. It can just be easier, it's more relaxing that way. I want you to put one hand on your lower ribcage and one hand on your belly. And you're going to take a few deep breaths in, trying to breathe into that belly, but also into that lower rib cage. Okay, so just a few breaths here. Breathe in through the nose and out through the mouth. Now, what we're trying to get here is breath going into both the lower hand and this rib cage. Okay, so we've got a 360-degree breath into our back, into our sides, into the lower rib cage and into the belly. Okay, what we don't want and what we're trying to avoid is this big chest breath and nothing going into the belly, or overcompensating and doing a big belly breath and nothing going into the chest. Okay, so we kind of want a little bit of movement at both of those places first. Okay, that's what we go through in the first tutorial. Stage 2, we're going to check in with our diaphragm and with the muscles in the top part of the abdomen. Okay, these upper muscles, they're all connected, right? But sometimes there can be more tension in these upper abdominal muscles. So we're going to tuck our fingers under our rib. We're going to find the bottom of our rib cage, tuck our fingers under the rib cage, and hopefully it will be soft. Okay, if it's really hard and you can't get your fingers under at all, there's quite a bit of tension there. And this is where a pelvic floor physiotherapist can really help you out, because they can help you with some manual release here of those tissues. Okay, whether or not you can get your fingers under, we're going to take a few more breaths in, and we're going to breathe into the tummy and into the lower rib cage. And what you should find is that your fingers get pushed out from under your rib cage, and then as you breathe out, your fingers are going to go back up and into the rib cage as your diaphragm relaxes up and in. Okay, again, I go through this in loads of detail in the basic breathing tutorial. So go and check that out. If you feel any tension here whatsoever, go and check that out, because
if you've got loads and loads of tension up here at the top of the system, that's always going to be pushing down on your pelvic floor, and your pelvic floor is going to have to react to that. So that's sometimes why there's lots and lots of tension in the pelvic floor. And once you release this top half of the system, that bottom half of the system doesn't have to tighten up all the time to counteract all that pressure coming down. So sometimes it can be the missing piece of the puzzle, and sometimes it's something that physiotherapists don't look at. They just focus on the pelvic floor. So I want you to understand that the pelvic floor is part of this abdominal canister and part of this system. So you want to make sure that you know what's going on with the upper abdominal muscles as well. Okay, what we're going to do now is we're going to have a little bit more of a focus on the pelvic floor. So now you know what's going on with the top half of the system. I want you to take a few breaths in and try and breathe down into your pelvic floor, and I want you to try and feel it expand and stretch and relax, and then as you breathe out, come back in and up. It's not squeezing in and up, but just from being stretched out, it's just recoiling just a little bit, okay? So another big breath in to the lower belly and down into your pelvic floor, and then relax back out. Take a few more breaths here and really close your eyes, really try to relax your pelvic floor, really try and just let go of those muscles, okay, really focusing on that area. And if you can't let go, and if you can't feel that release of those muscles, it's totally fine. It's not easy to access from this position. We're going to try a couple more positions now that might be a little bit easier to access. So from here, we're going to come onto all fours. Okay, so from this all fours positions can be a little bit easier to access the pelvic floor sometimes. So we're just going to do the same thing, breathing in, dropping the tummy, breathing into the tummy and the lower rib cage, and trying to breathe into that pelvic floor. And breathing out, okay? Try and breathe in all the way down into the pelvic floor and breathe out and feel it recoil just a little bit. And if you still don't feel it here, we're going to try one more position, because this often is difficult to feel as well. Incidentally, men often feel this better here. But for women, you're going to come into this deep squat position. Both heels on the floor, wiggle around a bit, find something that's comfortable here. If you can't do this and you're going, oh, Jen, whatever, like grab hold of something really, really heavy and try and sink down into this position. I've got loads of tutorials on squat mobility. Go and check out those tutorials and work on this first, because if all these muscles are super duper tight all around your hips, then that's going to influence your pelvic floor as well, okay? So if your lower back's tight, if your glutes are tight, if your hips are tight, this is going to all impact their adjacent tissues, their adjacent muscles. They're going to impact your pelvic floor too. So go and check out my mobility routine for hips and for squat mobility. I'm going to link in the comments, in the description below, okay? So once you've gone and done that, you're in this deep squat position. Okay, from here, get your elbows inside your knees and push your knees out a little bit and try and just relax into this position. We're going to take a couple more breaths down into the pelvic floor. Okay, nice big breath in, and also notice that in this position it's quite hard to breathe up into your chest because you're a little bit rounded over. Okay, so nice big breath into that belly. Feel your belly expand against your thighs and feel your pelvic floor expand and relax down towards the floor. Okay, then and stretch a little bit, and then as you breathe out, just feel it come back a little bit to that neutral position. Okay, it's not a big pelvic floor contraction, it's just a little stretch in the tissues, and then a relaxation back to where it was. Okay, so close your eyes and just take a few deep breaths here. So breathing in into the pelvic floor, feel that those muscles stretch out and descend just a little bit, and then as you breathe out, feel everything relax. Feel your tummy come away from your thighs and feel your pelvic floor come back up and in just a little bit. No squeezing, okay? You don't need to do pelvic floor contractions. Or you might need to do pelvic floor contractions. That's what you need to go and see a pelvic floor physio for. But I'm not going to tell you to do pelvic floor contractions. I'm just teaching you how to relax and tune into that pelvic floor. And let's do a few more breaths here. Okay, nice big breath in. Diaphragm comes down, belly comes out, all the pelvic organs go south, pelvic floor expands and stretches. And then as you breathe out, let the pelvic floor muscles come back up and the tummy comes back in, pelvic organs go back north, and the diaphragm relaxes, okay, and goes back up. One more time, nice big breath in, feel that stretch in the pelvic floor, and breathe out and feel it come back to normal. Okay, so that's it. That's my breathing tutorial for tight pelvic floors, for hypertonic pelvic floors. It's really, really common in women who haven't had babies, but it does happen in lots of mums, especially ones who've kind of overdone the whole Kegel thing and haven't learned how to relax. It's really common in kind of that A-type personality and a bit stressed, a bit anxious kind of person. And there's probably a lot of connection between what's going on in our heads and what's going on in our bodies. I don't know what the sort of literature is on this, but people seem to, just from my experience as a trainer, people seem to store tension in different places in their body. Some store it in their shoulders. They always have tight shoulders and necks. Some people have it in their pelvis and in their hips, and they always have tight pelvis and hips. And to some extent, that's going to be something that you may not be able to control completely and you may not be able to get rid of completely, but you can definitely help yourself in the process. Give that tutorial a go. Let me know how you found it. Go and see a pelvic floor physio. It's really, really important. They can give you way more personalized information for you. You don't have to live with pelvic pain. You don't have to live with pain during sex. You don't have to live with frequent urination or stress urinary incontinence or whatever the symptoms are that you're having from a too tight pelvic floor. And the final tip that I'm going to leave with you is learn how to do self-release on your pelvic floor. You can do that with a thumb, you can do it with a Thera wand. I'll link into the tutorial of a great pelvic floor physio that I know who has a great tutorial on this. But again, I would go and see a pelvic floor physio who can really help you address this issue and give you really personalized information for you, rather than just some tutorial on the internet that may or may not be relevant to you. So I hope that helped. If you like this video, give it a thumbs up, subscribe to my channel for more stuff on pelvic floors, postpartum, prenatal, all of that stuff. And if you know somebody who needs this video, send it to her. And thanks for watching.